Hi, this is an introduction to the patient Sofia Petrillo. Upon completion of the activity, the student will demonstrate an understanding of the preoperative experience for the client with a chronic condition, demonstrate appropriate preoperative teaching for this client, develop an appropriate patient-centered plan of care, compare and contrast the preoperative concerns and needs for this client with those of healthy individuals. So the directions are this video is going to provide you information about the patient. So it's important for you to take notes during this process. Pause the video as you need to. You're going to assess the vital signs. You're going to hear a medical history. That's all going to be part of what this video is going to provide you, but you are going to need to document that. So make sure you're taking notes so that you know what to document. When listening to some of the sounds, consider putting on your stethoscope to listen through the speakers. A student taught me that trick. Put on your stethoscope, turn the volume way down, not to mute because then you can't hear anything, and then put your stethoscope up to the speaker and see if you can auscultate the sounds that way. And after this slide, the patient information is going to begin. So our patient is Sofia Petrillo. Her date of birth is August 12th, and she's 85 years old. She's being seen by Dr. Weston, and she's allergic to penicillin. What happened to Sophia is she was found on the floor of her apartment by her daughter. Her daughter tried to reach her by phone for 24 hours, and then when she couldn't get a hold of her, went to check on her. Sophia was barely conscious on the scene, and an ambulance was called. The following signs were noted on assessment by the paramedics. Outward rotation of the left leg, and the left leg is visibly shorter than the right leg. She'd also been incontinent of urine and had some bruising on that left hip. She arrives via an ambulance to HCC Hospital emergency room, and Sophia is placed in a trauma room. Her daughter is with her. These are her vital signs. You're going to need to record those in the chart. The temperature was taken orally. This is her respiratory rate. This is her blood pressure. So the nurse is going to begin a medical history. The nurse is going to review any medical concerns by system, any medication the client currently takes, any surgical history, psychosocial concerns, including any substance use. Be sure to write down any key information discussed here. Good morning. My name is Laura, and I'm the nurse here, and I'm going to confirm with you the information you provided earlier. Is that okay?
Yeah, that's right.
Can you tell me your name and date of birth?
My name's Sofia Petrillo. I was born August 12th, and I'm 85 years old.
Okay, so it tells me that you're allergic to penicillin and that you react by a rash. Is that correct?
Yeah, that's right.
Your medical history includes high blood pressure, atrial fibrillation, and diabetes. Is that correct?
Yeah, that's right.
It says you take the following medications: metoprolol, 25 milligrams every day, warfarin, 5 milligrams every day, and metformin, 850 milligrams every day. Is that correct?
Yeah, that's right.
It also says that you never smoked and that you really don't drink very often, just every once in a while. Is that true?
Yeah, that's right.
Okay. And you live by yourself? Is that correct?
Yeah, that's right.
Okay. You're in a high-rise apartment building and you don't have any stairs to get to your apartment, correct?
Yeah, that's right.
All right. And it says you have several daughters, and I see that your daughter Dorothy is here with you. Is she going to help take care of you after surgery?
Yeah, that's right.
All right. Thank you. You have completed your assessment on Sophia. You found that her nervous system, when you look at it by a system, her nervous system, she's awake, she's answering questions appropriately. Cardiovascular system, her heart rate is irregular, pulses are present, her capillary refill time is brisk. Respiratory, you've already assessed her respiratory rate, so you can describe her respirations, but her oxygen is at 4 liters per minute per nasal cannula. Her breath sounds are clear throughout. Her GI, her abdomen is soft, bowel sounds are present. Genitourinary, she's voided 100 mLs of dark amber urine on the bedpan. Musculoskeletal system, she has good strength except in her left lower extremity. And Buck's traction is in place, and the next slide is going to show you that. So they're going to apply Buck's traction in this video. They're currently assessing her skin before they apply the boot. Notice that the second nurse was holding her calf steady for that, or his calf. Now the calf is going to be elevated on a pillow and it's lifted gently. The device is hung and counterweighted with traction, and it's usually a weight. In this case, because this is a nursing school demonstration, they don't have weights, so they're using an IV bag to simulate the weights. And the next slide will show you a picture of what it should look like when it's complete. So you can see in this picture, this is what the Buck's traction should look like. It should have a pulley system, and you can see that the rope goes through the pulley system and it hangs freely so that the weights can hang freely. So Sophia tells the nurse she needs to use the bathroom. How would the nurse manage this at this time? Right now, the nurse is going to look over the chart and begin completing the pre-op checklist. All right, the operating room calls and says they're on their way to pick up Sophia and to get her ready. The nurse checks with Sophia about her belongings. And so her glasses have gone and her dentures have gone with her daughter Dorothy. She has a ring on that won't come off, and so the nurse has put a piece of tape around that, and she has no other belongings. Now the nurse finishes up the pre-op checklist. Here are the orders, and you have access to these in the chart that you should be able to see these orders. The nurse is going to get the medication. She's first getting the oral medication. She's double checked it with the chart. She double checked it at the orders. And so there you go. The nurse is also now going to get the IV medication ready. And so you can see the IV medication is there. So at the bedside, the nurse validates the Sophia's name and date of birth and administers the oral medication. She hangs the piggyback medication on the IV pole to go with Sophia, but doesn't get it started. Now I want you to check the pre-op orders again and make sure everything that has been addressed in some way that Sophia needs before she goes to the operating room. Hi, Sophia. You took your medications and the operating room is on their way right now. All right, so wrapping up. Your responsibilities now are to complete this simulation, or to complete this simulation is to complete the documentation. So you're going to complete the assessment based on what you found here, the medication administration record. You're going to write a narrative note about her being sent to the operating room, and you're going to do the pre-op checklist. And make sure everything is addressed in the pre-op checklist as you go through it.